In this video today, I'm going to talk about how you can self-release the muscles in the front of the forearm, the back of the forearm, and two other specific muscles, pronator teres and the brachioradialis muscle. When looking at the muscles of the front of the forearm, some of them cross the elbow, others don't cross the elbow, but all of them except for one comes over and goes into the fingers, controlling the fingers, closing them, and the thumb closing it as well. So gripping type activities and repetitive activities such as typing are going to be things that are going to work and overwork these muscles. To treat these muscles, we can look at them in two ways. We have to separate them into muscles that cross the elbow and muscles that don't cross the elbow. To treat the ones that don't cross the elbow, we can have the elbow bent, it doesn't matter. Come down onto the muscle, bend the wrist back, open the fingers up, feel the tension. All the while, I'm pushing down and rolling towards my elbow. Push down and extend the fingers. To get into the muscles into this part that go across the elbow, what we want to do is we want to start with the elbow bent, straighten out our elbow, stretch our wrist back. All the while I'm compressing and pulling towards my elbow. Find the spot, straighten, and pull. When we look at the back of the forearm, we have to realize that there's lots of muscles that are involved. A couple cross the elbow, all of them cross the wrist, and some of them go to the fingers and thumb. They aid in extending the fingers and thumb, extending the wrist, and also a little bit of elbow flexion. So if you're working out and doing reverse curls, you get some of the extensors involved in that, not only for holding the wrist straight, but also aid in flexing the elbow. This muscle gets overworked, and we have some tender spots. We can use the ball, or we can use a little bit more leverage. If we take the ball and we have the elbow bent, we can get to some of the deeper muscles. So we pin down that tender spot, we draw the ball pushing towards the elbow, and then we flex our wrist, flex our fingers and our thumb, and we search for our tender spots. As we get closer to the elbow though, we can start extending out the elbow so that we can get more tension going through this area. Now you have to realize that there is a nerve that travels down the back of the forearm and goes into the fingers, into this part of the hand, and that's our radial nerve. If we start getting tingling there, or burning, shearing pain as we go through this movement, we're treating that nerve, and that's just going to irritate it, so don't do that. We want to get a little bit more leverage. I can pin it down with my knee, and I can press in as I bend my wrist over. As I bend, and I can get in there and get more tension than what I could produce just from my hand. There's one muscle on the front of the forearm that doesn't cross the wrist or into the fingers, and it's called the pronator teres. It originates onto this little bony bump of our elbow. We place our heel on our hand and lay our hand down. Our thumb represents that muscle. When that muscle contracts, it turns the forearm over. So any activities that require us to pronate the forearm repetitively, or restrain or prevent supination, the muscle is going to get overworked. So we get a ball, press down onto it, draw the ball towards our elbow, supinate, stretch our arm out. We search for those tender spots through that muscle. Now there is a nerve, the median nerve, that goes down into the hand. So if you're getting tingling into your hand, move the ball slightly off so that we're not aggravating that nerve. Now there's one muscle that isn't considered part of the front of the forearm or the back of the forearm. It's kind of along the side. It's called the brachioradialis. And that muscle, they call it the coat check muscle. So if you're holding a coat, or they call it the beer drinking muscle as well. So if we're we add resistance with the hand in what we call semi-pronated or semi-supinated, kind of in between. We have that muscle pop out right here. Muscle is predominantly muscle here, tendon down here, so treating down here is useless. But we get onto that muscle, draw the tissue up towards your elbow, straighten out your elbow, straighten out, straighten out. We don't have to turn the wrist or forearm, we just keep it in this position the entire time. For this video, make sure you subscribe, check out some of the other videos, and please share.